Hi, I'm Dr. Vicky O'Dwyer. I'm a consultant obstetrician and gynaecologist at the Rotunda Hospital. Menopause is when a woman's periods have stopped for at least 1 year. It's due to a reduction in estrogen and progesterone when the ovaries stop working. The average age for menopause is 51, but we do see a range from 45 to 55. So we see a reduction in hormones estrogen and progesterone, and that leads to most of the symptoms that you hear about that are associated with menopause or peri-menopause. So this includes hot flushes, night sweats, joint pains, mood changes, irritability and anxiety, to name just a few. So after menopause, bone density is affected. So some women can develop osteopenia, which is a reduction in bone mineral density, or osteoporosis, where it's really reduced. So this is detected on a DEXA scan, which is recommended for peri or postmenopausal women. And you can counteract the osteoporosis or prevent further development of it by taking calcium and vitamin D, bisphosphonates, or HRT. HRT, or hormone replacement therapy, is for most women a combination of estrogen and progesterone. The estrogen is what relieves the menopausal symptoms, and the progesterone protects the lining of the womb. So for women who've had a hysterectomy, they can take estrogen alone, but for those that still have a womb, they require both estrogen and progesterone. And this can be given in a number of forms, so either tablets, patches, or gels. There is a small increased risk in breast cancer with HRT. So we go from about a risk of 24 per thousand to a risk of 28 per thousand with HRT. With the patch or gel forms, they are safer than tablets and they have a lower risk of clotting disorders. So things like clots in your legs or your lungs. HRT was really widespread until about 2002, when two big studies were published. So the Women's Health Initiative study and the Million Women study. And what these found was that there was an increased risk of breast cancer with combined estrogen and progesterone HRT, and really overnight women stopped taking it. We now have different types of estrogen and progesterone in our HRT that are much safer. So I think that's why women are starting to talk about it more, and as more women go on HRT and realise that the new forms are safer, it becomes more widespread. So peri-menopause is that range from 45 to 55 where you still have periods and your hormones are fluctuating, and that's often when you get those menopausal symptoms like the hot flushes, the night sweats. So it covers a wide age bracket within usually a couple of years of your period stopping. No, so some women will go through menopause with very few symptoms. Their periods will space out and then stop. They'll have no hot flushes, no night sweats. They don't need to see a specialist or go on HRT. The one group that will always need HRT are those with premature ovarian failure. So that's when their periods stop before the age of 40. And it's really important, not just for their bones, but for their heart health, and to have normal hormones helps with these. So they should stay on HRT until the natural age of menopause, around 51. So referral to the Rotunda Menopause Clinic is a GP referral only service. We aim to see women who have complex medical issues, including a history of breast cancer or other cancers, hypertension, or at risk of a clot in their leg or their lung. We're also happy to see women who are on HRT who are having issues with their current HRT preparation. In addition to HRT with estrogen and progesterone, many women are also taking testosterone. This is used to help libido. It's used topically A small amount, a pea-sized amount of a gel is applied to the stomach and it's used every day. We can check testosterone levels then before and after starting treatment to make sure that you're at the right level. Definitely, we're seeing a huge amount of women coming through our general gynae clinics for lots of reasons. They might be having problems with their periods, and they'll also happen to ask, what about HRT? Do I need it? Can I have it? We're seeing it more in the media. Joe Duffy was probably the first person to talk about it, and there's lots of good books out there as well on HRT. So Dr. Jen Gunther's book. Many GPs are also menopause specialists, so it's best to check with your own GP first.